Good morning. I'd like to call this meeting to order. Good morning and welcome to our Community and Health Services Committee meeting for February the 10th. Today we'll be hearing from a delegation regarding a safe tenting framework as well as discussing two reports pertaining to substance use prevention. I'd like to now call on Regional City Clerk Tim Brubaker to conduct the roll call.
Thank you. Regional Chair Redmond.
Present.
Councillor Craig. Present. Chair Erb.
Present.
Councillor Foxton.
Present.
Councillor Gowing.
Present.
Councillor Harris.
Present.
Councillor Hunick.
Present.
Councillor James.
Present.
Councillor Liggett. Councillor McCabe.
Present.
Councillor Nowak. Councillor Rodriguez.
Present.
Councillor Salonen and Shantz are both running late. Councillor Verbanovich. And Councillor Wolf. And she's on screen. I can see her. Thank you, Chair.
Online. Thank you. As we begin this meeting, we are again reminded that many of our homes and places of employment in Waterloo region are situated on the land that is the traditional territory of the Haudenosaunee, Anishinaabe, and Chinatan peoples. We recognize and deeply appreciate their historic connection to Waterloo region, and we also recognize the contributions Indigenous peoples have made in shaping and strengthening this community. We are grateful for the opportunity to live and work here and reaffirm our collective commitment to keep the promise that reconciliation takes place through learning and community building with Indigenous people who continue to live here. We are all treaty people with a responsibility to honor all our relations. I'd like to begin by acknowledging that February is Black History Month. Black History Month, celebrated every February, is an important opportunity to honor the diversity, culture, and achievements of Black Canadians. It also invites us to reflect on the ongoing impacts of systemic racism and the work still required to advance equity and inclusion. This year, the region is proud to once again feature the popular GRT bus rap created by local artist Vanessa Inaka-Oso. Originally commissioned for 2025, the rap has been reissued with the support of 10 community organizations, including Nigerians in the Waterloo region, Somali Canadian Association of Waterloo region, Afropolitan, Women Dignity International, Adventure for Change, Canadian Caribbean Association of Waterloo region, African Canadian Association of Waterloo region and area, Ghanaian Canadian Association of Waterloo region, African Family Revival Organization, and the Digmillions of Everfall Valva Festivals. Vanessa is the founder of Vanessa X Corner, a digital art platform dedicated to celebrating the beauty, diversity, and vibrancy of Black characters through bold, cartoon-inspired illustration. Her work extends beyond visual art. Each character she creates reflects the strength, resilience, and individuality within the Black community. Through her designs, she challenges stereotypes, expands representation, and uplifts Black voices in public spaces. Community partners shared that continuing this project helps build momentum, strengthen relationships, and reaffirming the region's ongoing commitment to equity, inclusion, and cultural representation. The theme of this year's artwork, Black Excellence, Past, Present, and Future, recognizes the countless ways Black individuals and communities have shaped and continue to shape Canada's identity. I'll now call on Councillor James, followed by Vanessa, to provide some additional remarks. Councillor James.
Thank you, through you, Chair. I just want to thank Vanessa for providing this amazing piece of artwork that is truly reflective of the Black communities and the diversity and recognizing it. You know, our history is not tragedy. It is something to be celebrated, and the contributions that many have made and continue to make. I also want to thank my council colleagues and their support and staff in this, because it does show that while there's lots to be done in terms of equity for many groups, that progress is happening. And to see that artwork, to see it reflected, to see the region taking, a firm stand on ensuring equity and inclusion for all of the residents in this region is something that we should be proud of. And as I sit here, I'm incredibly proud of Vanessa, the work that you've done, and the community groups and the collaboration that took to get this to fruition. So again, there's a beautiful bus. I'm proud every time I see it, and I know that it is reflective, and the importance of being able to see yourself reflected is so important. It's so critical, especially for younger generations. So I'll stop there, Chair Erb, but it's a proud, proud moment for me, and I know for all of the many Black communities to see this throughout the region, throughout this month and beyond.
Thank you. Vanessa, would you like to come to the podium and share some thoughts?
All right. Good morning, everybody. Once again, my name is Vanessa Nkanso-Okori, and I am the artist behind the Black History Month bus wrap. It is an honor and a privilege to be here. I just want to say that the being called on to create this artwork was a very overwhelming, but in a good way. Growing up, there hasn't been a bus with characters on it that look like me. There wasn't a lot of cartoons with characters that look like me. There wasn't a lot of representation. And as I've gotten older, I've come to realize the importance of representation, just outside, not just within, but in different areas in terms of science, television, or even just on a bus. And it comes with a sense of community. When you see people in areas that look like you, it's not just about seeing that representation, but it's also being able to connect to them, being included in the story, and just the thought that I'm included in everyday life as well. And the impact that this bus has had, it is beyond words. I'm grateful for the 10 organizations that backed and supported me. I've worked with 2 of them. I run different art programs for their organizations, and the rest of them, I haven't worked with them. I don't know anything about them, but they decided to support this work, and I'm truly appreciative of it. And once again, thank you.
Thank you for being here, for your creativity and helping us on this journey. Thank you. We have, are there any declarations of pecuniary interest under the Municipal Conflict of Interest Act? None? We have no presentations. We have some delegations, and just before we begin with the delegations, I'd like to remind everyone of some guidelines for participation. As you are, if you're joining us in person, please proceed to the podium when you are called to speak. Additionally, some general reminders: if you conduct yourself in any of the following manners, it will result in an immediate removal from the meeting: interrupting councilors, staff, or other delegations, derogatory statements about councilors, staff, or others, and hate speech or defamatory comments. And one last reminder of delegations: please do not take offense if following your presentation there are no questions from council. This is council's time to really listen and reflect upon the opinions and ideas shared with us from our community members. As a quick reminder to members of the audience, you are asked to maintain order, and this means that you may not address the committee without the permission of the chair, interrupt anyone, disrupt the meeting with unreasonable noise or vocal expression, such as applause, booing, or cheering, and displaying of signs or posters. David Alton is here as a delegate. David, welcome. You have 5 minutes if you want to proceed to the podium.
And then just for the slides, do I just say next slide? Is that how it works? Okay.
I think, yep.
Okay. Good morning, everyone. I'm David from the Social Development Center, and we are just, our intention today is to help you continue the conversation on safe tenting frameworks, on a public camping bylaw, on an alternative to criminalization of encampments. So could I have next slide? So what we've been up to for the past couple months is doing some targeted engagements in community on a public camping bylaw. So we had a petition. I believe the clerks have processed it in a way that y'all can review all the signatures yourselves. But as of yesterday morning when I submitted, we had 870 signatures on the paper petition, and then online there was also an online petition on change.org, which can't be processed in the same way, but there were 950 signatures on there, which is a total of 1,820 signatures. Of course, give or take, there might be some duplication. And I say this was a targeted engagement because this was not just a petition that was looking at everyone, it was looking at key stakeholders in this conversation. So first and foremost, we targeted service providers who, since the beginning of the plan to chronic homelessness, have been working with staff to really emphasize the need for alternative solutions for encampments. It's why it's an action in the plan to have an encampment strategy, and it's why the lived experts, when they presented their guidelines, recommendations to the plan, they also were specifically interested in alternatives for encampments that aren't criminalization. And we heard a lot of feedback back from service providers who really went out and got a lot of signatures for us. So I really want to emphasize there is a lot of interest from service providers because it makes our job so much easier when we don't have to hunt down people and rebuild their base stabilization over and over and over again, which happens in municipalities where there are evictions consistently. Then it just means the service providers have to start over and over and over again every 2 weeks, which increases safety risk for everyone involved. But we also did some downtown engagements. We had 3 events targeting downtown communities, particular downtown businesses, targeting the people at the Kitchener Market, and trying to really understand their needs, because we know that encampments have impacts on downtown businesses, on downtown people, and we know that actually without safe tenting frameworks, those impacts actually are likely to increase because the population is more destable. And we also did some rural engagements. We talked to some churches in St. Jacobs, St. Agatha, and Mannheim, because we also want to make sure that those voices are part of this conversation. So next slide, please. So building on what Councillor Wolf said at the last meeting, the whole point of this is really that for council to establish an option of last resort, or what I like to say, a floor of human rights in our community. What is the base floor that you can have access to? And so without safe tenting frameworks, truly the floor is criminalized existence. Yes, we know that there are shelters, there are transitional housing, there are options, but when there are so many more people who can't access them or are experiencing barriers, where do those people end up? Those people end up essentially spiraling through traumatizing events over and over and over again. And when we interviewed people, they said that without safe encampments, they look to the backyards of businesses, they look to the backyards of homes, they look to the downtown areas to find some stabilization, which means they're traumatized, they're experiencing more traumatizing events, and they're moving closer and closer to community. When you have safe tenting frameworks, there is a clear space for people to exist and establish some level of stabilization so that we can then build better human rights on top of that. So this is what this conversation is about, just establishing a floor, that option of last resort, so that people who, for many, many different reasons, can't access shelter, or there isn't enough space, or they're experiencing barriers, they have places to go. Next slide. So this is a lot of language. I hope you review it, but the point of this slide is just to say that, as you probably are hearing, the line of precarity in the housing crisis is increasing. It's now in the world of owners. People who own their own home are experiencing precarity. And the most important thing I'm talking about is supportless, which is we have a growing population of people who do not have access to any support, and this is something we do not want to see, and a safe tenting framework is trying to address that. Next slide, please.
David, sorry to interrupt. Just want to remind you, you're down to your last minute.
I know, I'm realizing, so I'm going to focus on the most important things. The point is that we're going to continue doing this engagement plan. We know that lower tier municipalities are part of the solution, so we're planning on going to all the lower tier municipalities over the next 2 months. Our colleagues at Wilfrid Laurier University are coming back here with research that they did about encampments across Ontario and the country. So you'll hear more about this, and obviously the court case is happening at the same time. Next slide. And we think that there is a place for the region. We're not coming here asking you to make a decision because we think you're not there yet, but we want you to think that you actually do have a role and do have power to create a coordinated framework and to set up the rest of the region for this. And so we're asking you to support our engagement process, to allow your staff to be a part of that process and to help us continue this work so that we can provide an alternative to criminalization and litigation. And lastly, last slide, it just is this, and specifically you do have the transit hub. I do like, there's a lot of land there that I think there is options to put a safe tenting framework into your construction plan. And here I showed you the site. You could have a track widening zone and a safe tenting zone on the same site. That's one thing you could do. So thank you for considering this. I hope you can keep the conversation going. And I hope you consider all 1,820 signatures seriously, because people are interested in having a base option of last resort.
Thanks, David. Just stay there. There's a couple of questions from council members. Councilor Unick.
Hi, David. Thank you for coming. Thank you for the presentation. I read the petition. 1,800 signatures is a lot. I'm glad to know that. I guess part of the resistance for me toward the safe tenting bylaw is that I don't want to promote an option that is fundamentally unsafe. And so the floor of human rights, as you suggested, kind of seems like a pit to me. And so I'm just wondering why you would spend time advocating for a safe tenting bylaw rather than supportive, affordable housing.
Yeah, so, and this is a very common hesitancy we encountered in our engagement. I would say two things. One, that we are all very familiar with the barriers to building supportive housing. We have a huge capital crisis in this community. It's the reason you at council voted down 3 huge capital projects on housing. And we also there's like supplies, funding. It's not easy to build housing. And so if you don't have an option of last resort, then you really have a pit. Like right now, what people are experiencing in our community is quite an escalating criminalized existence. So yes, encampments are not this beautiful human right framework, but there is a base level of stabilization there that allows at least a place for them to exist, which means that they can manage their health, their mental health, their community. It means service providers can better support them when they have a safe, designated place to exist. So the ask is kind of one rooted in the reality of the crisis, that governments are not building housing fast enough and that there's many barriers and delays to building housing quickly, but we still have human rights obligations. And what is the floor? What is the floor that we're going to hold?
Councillor Foxton.
Thank you, and through you, Chair. I love the idea that everybody could have a home, but I don't think it's realistic in this economy. I think we're struggling ourselves to provide affordable housing and have not achieved what we hoped to achieve in this market. So, but people are becoming homeless every day. So do we leave them in that void? And it is a big void. What I heard the last meeting we had in regards to the people was that people don't choose to be homeless. It's not a choice. And I can remember years ago when Dave Jaworski was the mayor of Waterloo, and he stopped an individual and said, "Every day I see you hiking from 100 Vic." And the gentleman said, "I have a full-time job in Guelph, but I went through a divorce and I lost everything. And 100 Vic was the only place I could live." I think if we did this right, if we did safe tenting, providing them with and I want something on the ground so they're not right on the ground. Mm-hmm. It's like even if it's just boards or whatever. Mm-hmm. And then services right there for them, mm-hmm. and that's watched and maintained. I think this is a stepping stone leading into affordable housing because we're not there. We can say all we want to do about affordable housing, but with the finances and the demand, we can't meet it yet. But I think stepping stones is what we need. And people don't choose to be homeless. They don't choose their lifestyle. So again, I say to you, I would totally support this, but it needs to be maintained. It needs services. I want people to know they're safe there. Another thing I heard when the groups came was that...
Councillor Foxton, is there a question here?
I would support this with the purpose of the facilities to maintain. Thank you.
Okay, thank you. There are no other questions from council members. Thanks, David, for your presentation. Thanks for your continuing advocacy for people that don't have a voice. And I always personally appreciate your the tone that you bring and the constructive way that you try to help. So thanks for being here.
Happy to talk anytime. I know you have a lot to consider in the next couple months.
We have no items on the consent agenda. On our regular agenda, item 7.1 under equitable services and opportunities. The next two reports are complementary in nature, so I'll call on Dr. Wong, Medical Officer of Health, to introduce both reports and presentations.
Thank you, Chair Urban. Good morning, members of council. Today, on behalf of a collaborative of partners that I would like to thank for being here, Public Health is bringing forward two complementary reports with presentations. The first one is called Collaborative Approach to Addressing Substance Use and Addictions, and the second one is called Youth Substance Use Prevention. These reports and presentations together provide an update on substance use in Waterloo Region, including local data, key programs, and community partnerships that address this issue across the full continuum of prevention, harm reduction, treatment, and community safety. The first report, the Collaborative Approach report, focuses on a coordinated and community-based approach to addressing substance use, which strengthens pathways to services and supports system integration to reduce harms and prevent overdoses. The second report, the Youth Substance Use Prevention report, is the upstream companion, emphasizing strategies that begin early in life and community partnerships that support youth-focused programs to prevent substance use and support mental health. In closing, substance use and addiction are complex individual and community issues that require a multi-component response. Together, these reports describe the collaborative work being done by community agencies, grassroots organizations, municipalities, and public health to make meaningful progress. And with that, I'd like to turn it over to the first presenters, if the chair would allow. Yes. Thank you.
Welcome.
Good morning, Council. My name is Katie McDonald. I'm the Manager of Health System Integration and Strategic Partnerships with Public Health. I'm here today with Tara Groves-Taylor from Community Health Caring and Ann Phillips from Sanguine Health Center to present on the collaborative approach to addressing substance use and addictions. Next slide, please. Today, we'll provide an update on substance use in Waterloo Region, including overdose and substance use-related trends and data. We'll highlight some of the key programs, strategies, and collaborations that support prevention, harm reduction, addiction treatment and recovery, and community safety. As we move into discussing data and trends, we just want to acknowledge that this data represents people, and each life lost was a person with loved ones, a person with hopes and dreams, and a person who should still be with us today. Next slide, please. So this figure shows the count and rate of suspected opioid overdose and drug toxicity related paramedic service calls in Waterloo Region from 2018 to 2025. The counts and rates fluctuated over time with a peak observed between 2021 and 2024, followed by a decline in 2025. In 2025, the rate declined to the lowest level seen since 2018. Next slide, please. This figure shows the count and rate of emergency department visits for opioid-related poisonings between 2018 and 2025. So the rate of emergency department visits in Waterloo Region has been declining over the past 3 years, and the number of emergency department visits declined by nearly 60% last year. So since 2020, the rate in Waterloo Region has stayed below the provincial average. Next slide, please. This figure shows opioid toxicity deaths between 2018 and 2025. So overall, the rates have fluctuated in recent years. In 2025, the number of deaths declined to a new low of 51. And since 2021, the regional rate has generally stayed below the provincial rate. So despite the recent declines in overdose indicators that you've seen on the last 3 slides, continued investment and commitment to prevention, treatment, and recovery and harm reduction services are required. People do still continue to experience consequences from the toxic substances, and these trends could shift at any time. Additionally, data does not capture non-fatal overdoses that are reversed in community. Similar trends are occurring at the provincial and national levels. Reasons behind the decline are unclear, but some factors that may be contributing to the decline are the illegal toxic drug supply, naloxone availability, and the reduction in the number of people at risk of overdose. Next slide, please. Addictions and substance use are complex individual and community issues. Solutions go beyond the capacity of one organization or system. Substance use requires a comprehensive approach across many sectors. Public health and many community partners are involved in multiple areas of work related to prevention, treatment and recovery, harm reduction, and community safety. In this presentation, we'll cover some of the work happening in treatment and recovery, harm reduction, and community safety, and the next presentation will focus on prevention. Next slide, please.
Thank you so much. Thank you, Chair and Council, for having us today. I was reflecting, it's hard to believe it's been a year since I was here last talking about this Heart Hub that we were hoping to implement. And happy to say that almost a year later, we are at 96% operations in the Heart Hub here in Waterloo region. I think as hopefully you recall, we looked at developing a model that integrated into the existing services in the community and leveraged partnerships and key service providers to really access the people that we were hoping to help with Heart Hub and its services. As such, we have 7 wonderful funded partners who operate Heart Hub with us, and we have fully established all of our tables, both strategy and accountability and operations at this point. The transitional housing program was a bit late in coming online due to a delay in funding until December 24th, I believe, of 2025, but we are set to have that in place by March of this year, which would have us at 100% operations with Heart Hub. We, to date, have had just shy of 3,000 service interactions with individuals who are change-oriented. We've served just under 350 unique individuals, and we've had 162 full intakes into a Heart Hub pathway that targets substance use. Currently, our next steps are looking at phased expansion out to the broader community, in addition to our 7 funded partners, as well as looking at really having a conversation about an alternate destination for health and wellness, for addictions, and for substance use that we're engaging with some key community folks, including paramedics, hospitals, and police services. So thank you.
Thank you, Katie and Tara, and Council and Chair. I'm Ann Phillips, and I'm the Senior Director with Sanguine Health Centre, and I'm the new co-chair for the Harm Reduction Working Group. As you may be aware, harm reduction focuses on reducing the harms associated with drug use, including reducing the spread of blood-borne infections and, of course, overdose prevention. This group formed through community engagement was in sessions that took place in the fall of 2024 when we were really focused on mitigating the impact of the closure of the consumption and treatment service site. The group is now working together to provide strategic leadership and coordination for harm reduction efforts in the Waterloo region. Members on the group include community agencies from various sectors, including harm reduction, mental health, social services, community health centers, police, paramedics, and public health. Our successes in 2025 have included expanded naloxone training. We've trained various organizations, an example of which is the Downtown Kitchener Business Association. We've improved harm reduction supply distribution and communications, increasing needle supply, naloxone access, particularly in downtown Kitchener, to help mitigate some of the impact of the closure of the CTS. And we're working to sustain access to those wraparound services for people who use drugs, providing safe spaces for people to access harm reduction supplies and naloxone, and to access the services like primary care and build relationships. Our next steps are to continue to address emerging issues and service gaps related to harm reduction, such as exploring opportunities for services in rural communities through collaboration with Engage Rural and ongoing data monitoring to understand impacts of the local drug toxicity crisis and local harm reduction programs. Thank you.
Next slide, please. So to support community safety, public health and community partners have a comprehensive sharps disposal strategy so that harm reduction supplies, such as needles, can be returned and disposed of safely. Sharps are collected through the needle syringe program, outdoor kiosks that are available 24/7, and the Working to Improve Neighborhood Safety, or the WINS program, that is a peer-based needle recovery program operated by Sanguine Health Centre. Waterloo Region Police Services also just approved their drug strategy that focuses on being an active participant in harm reduction and education, justice and enforcement, and community partnerships. Waterloo Region Police Services are also here today with us. Next slide, please. Public health will continue to collect, monitor, and report on data related to drug use and overdoses, provide mandated substance use services according to the Ontario Public Health Standards, which include the needle syringe program, the Ontario naloxone program, and working with community on community drug alerts. We'll continue to work with community partners, including the Heart Hub, the mental health and addiction service providers, and community collaboratives to support a multi-sector approach to addressing addictions and substance use in Waterloo Region. Thank you.
Thank you. I think you should stay there. There's a lineup of, or do you have additional reporting to this report?
We have another presentation, but
I think, yeah, we were thinking of maybe doing both presentations, but there are quite a few questions based on your presentation, so I think we're going to separate them. So, Councillor James.
Thank you, through you, Chair, and thanks for coming in this morning and for the work that you are doing for those members who are not just vulnerable, but substance dependent in our community. Just have a question regarding the data. So it shows that there's been a decrease in overdose and calls in 2025. I'm just wondering if there have been changes in the ways the data has been collected, and if this is indicative of real improvement. And I don't know how else to say that. Just thinking about the data collection, how it's collected, if there's been changes as a result, it appears that there's a decrease, but is something changed in the way the data is collected?
So the key indicators that we are touched on today, so emergency department visits, opioid deaths, and the paramedic service calls, those haven't changed. We're seeing these trends provincially, nationally, so our community is similar. There's 3 factors that the Public Health Agency of Canada, after doing some research into it, thinks that might have attributed to that decline, one of which being the toxic drug supply, the second one being the availability of naloxone in the community, and the third being a reduce in the number of people that are at risk of overdose. So again, it's hard to say exactly what is contributing to the decline. It could shift at any time, especially with the illicit toxic drug supply.
And then I just have one follow-up question. It's regarding the transitional housing program. You say it's going to be open in the spring. Can you just confirm how many beds that is?
Yeah, through you, the chair. That's 12 beds, and it's a transitional housing program. It's an abstinence-based program that we're going to be offering. House of Friendship is running that program.
Okay, thank you.
Councillor Hunick.
Thank you, Chair. Thank you, Ms. McDonald and team, for the work that you do and the compassion with which you speak about it. You touched on this a little bit, but I'm wondering if you can elaborate more on the gaps within the Heart Hub and the things that you hope that Regional Council will advocate more to other levels of government.
Thank you. Through you, the chair. We're early days, obviously, in implementation, and I think I alluded to the fact that some of the challenges have certainly been outside of our control. As you also may or may not know, the Heart Hub has come online in a cascade across the province. So there were 7 or 8 initial implementation sites, and then another sort of 14 to 16 that are coming online now. That creates challenges in implementation because you're sort of building the plane as you fly it, so to speak. So I think some of the challenges we're experiencing now is a desire for our funder to impose structure on a system and a service delivery model that's already established. So I think that's creating a lot of challenges for us because we're having to then advocate for things that we have in place that are working well in our community. I think we've sort of touched on, obviously, the supportive housing crisis in the community. The transition beds, while we're very happy to have them coming online, it's a key aspect of our Heart Hub. There's 12 beds. We do know that we have a lot of supportive housing units in the community that are built and ready for people but don't have operational funding. And so the pathway out of transitional housing when someone comes through the Heart Hub journey is still a key piece that's missing in the framework.
So I'm listening very closely to what you've said, but I don't want to misconstrue any of it. So if you would like to email council and note what you've just said, that would be really lovely.
Yeah, I can certainly do that.
Thank you.
And if they could ease up on the data and reporting, that would be great too. So I'll include that.
Thank you.
Councillor Foxton?
Thank you, and through you, Chair. Love seeing the drop, and that the groups are working together. You had one comment was emerging issues, but you never stated what they were. What are the emerging issues? Somebody did say that, honest.
The harm reduction working group would be committed to watching for emerging issues. And so I think our emerging issues are the what's going to happen next in terms of our funding opportunities from the province. As you know, they have stalled us out from operating the consumption and treatment site and safer supply programs, and so the political context in which we work is certainly an emerging issue. We're always watching the trends on the street. The question regarding the why do we see less overdoses happening? We monitor through a drug checking machine, what are the supplies on the street? We could be seeing less fentanyl on our streets now. That could be one of the reasons contributing to less overdoses. So the emerging issues, some of them are longer term issues, but some of them are the day-to-day what's happening on the street right now.
So if I heard you correctly, the funding issue is not clear as to how it's falling out. So you could actually have us advocate for you at Queen's Park in regards to this.
Yes.
So please work with us in doing that. We go quite often. AMO's coming in August. If we could hope to get a delegation with Sylvia Jones to talk about the funding for this. And I see Chair Edmund nodding her head, so I'm sure the region will work on that. So work with us, give us the data that we can, and the framework that you work with so that we can put together a brief.
We would be most pleased to do that. And yes, if you asked what was the one thing you could do, it would be that to advocate for us. We are resource poor. We've lost a lot of resources, and we need to have the spectrum of services. Heart Hub is amazing. We need to have the complementary services to offer the people who are not just ready for treatment, but who may not be ready, or maybe on a wait list, or maybe exiting treatment, and that's a very vulnerable time. So we need the spectrum of services.
So you said your resource is poor, so we would need that data from you on exactly what, where, and then staff will put together the brief for us to go to AMO with.
Thank you.
Thank you.
Councillor Liggett?
Thank you, Mr. Chair. I want to ask a question with regard to the graph charts here, because it's pretty confusing to me. When you've got suspected overdose and drug toxicity, and then another page, you've got opioid toxicity deaths, how do we not know already that whether those ones all the way from 2018 to 2024, I would assume they've already gone through the coroner's investigation. How do we know they shouldn't be over on the other page of deaths versus suspected? How do they get locked, stay in suspected? Because it's what, 6 months for an autopsy, I think, where it's confirmed? So, and the 2025 ones, should we not know that by now, at least for the first 6 months?
So the first graph, suspected overdose, is paramedic service calls. So that's not related to, so that's not deaths, that's just the calls that go to paramedic services. The second one is emergency department visits. So we have that data, and that again would include anyone going to the emergency department related to opioid poisoning. And then the third one is related to the toxicity deaths. And I'm gonna bring up Monica to talk about that data specifically and around the coroner's data and the suspected versus confirmed.
Through you, the chair. So I'll just go over the figure for opioid toxicity deaths. So deaths, data from 2018 to 2024 represent confirmed opioid-related deaths. That's classified by the Office of the Chief Coroner of Ontario. But the 2025 includes both confirmed opioid-related deaths and suspected drug-related deaths. Since there's a delay in the release of the confirmed opioid-related deaths by the coroner's office, we also report on the suspected drug-related deaths. This data is provided by the Waterloo Region Police Services, and it provides a more timely data. And what we have found that historically, the number of suspected drug-related deaths reported by the Waterloo Region Police Services generally follows a similar pattern as what is classified later as confirmed by the coroner. So that's why we have a combination of suspected and confirmed while we get the data from the coroner's office. So I hope that answers your question.
It's very difficult, the sound system in here, I have difficulty, and my hearing's perfect, but I have very hard.
Yes, I did hear some echo.
It is, it's the bass and everything that's involved here, so I didn't hear a lot of what, I couldn't confirm a lot of what was being said there. But if I look at the suspected, when I look at that, it seems to me that we're talking more about costing, about how many times that the police and the paramedics have to go out versus the actual confirmed deaths from opioid. Is that what that chart is about here?
So through you, Chair, could you repeat the question?
Dr. Wong, do you want to interrupt?
Sorry, I'm just wondering if I might be able to assist. So when we look at paramedic service calls, which is what I think you're referring to, Councillor Liggett, when you are wondering about the suspect number. Yes. It's always going to be suspected because it's just the paramedic service call. So the important thing is that it's the same thing that we're measuring from year to year to year, which is when paramedics get a call and it's a suspected overdose, then they get dispatched. So that will always remain suspected because they don't then go back and find out from the coroner like what was the actual cause of the call that they got. That said, you are correct that the coroner has both suspected deaths and then several months, many months later, they confirm that or not with confirmed deaths. There is a delay of several months, usually between the suspected and the confirmed, so we track both because, again, we want to track apples to apples and oranges to oranges. So we use suspected number of deaths from the Waterloo Region Police, and usually after a few months, there are numbers that are confirmed by the coroner. So the important thing is that whatever we track is going to be the same over time. So you can see whether or not trends have really gone up or gone down. And we track both the suspected and the confirmed deaths. but there is a delay, as you said, of several months for the confirmed one. So we might not have that number as fast as we would have the suspected deaths. Hope that answers.
So Dr. Wong, if it's suspected, are they 100% sent to the coroner for an autopsy, or are some of them just not counted?
Monica might be able to, do you have that answer?
So yes, they are sent for autopsy, and then we'll get that data like months later. So that's why we use suspected drug-related deaths interim.
No, that didn't answer my question, though. My question was, is there potential for some of these suspected to never get to the coroner, or are 100% of them, do they go to the coroner?
So I have to take that back and answer that question. So maybe, sorry, when we're the paramedic service calls could be an overdose where there wasn't a death. So, which is this slide here. So this is the paramedic service calls. And so this is any call related to an overdose. If there is a death, then it would go to the coroner. If it was an overdose, then it could go to the emergency department visit if the patient chooses to be transported. And so if there's a death, then it would go to the coroner.
So yeah, so suspect deaths are assessed by the coroner. It's the same process year after year. So so we track more quickly the suspected numbers, but then those numbers are months later reviewed by the coroner, and then the coroner decides whether it is truly a suspect death or whether it's been confirmed.
Okay, thank you.
Chair Redmond.
I want to thank you all for coming in and giving us all this data. It's really important. I've always felt that government measures what it values and changes what it measures. So thank you very much. Specifically, I just want to ask about the timing of the funding for the Heart Hub. I don't know if this is Tara or Jennifer that wants to answer. Often, I've heard from other municipalities that were at the front of the line, as Waterloo Region was, that we were supposed to be first out of the gates for Heart Hub. And I hear what you're saying about sort of the reporting structure and some of the confines that are being put around you. So that would be really good information for us to take to the government. But I just want to have clarity that having gotten the rest of your funding at the end of 2025, is there now an imperative that you have to spend it by a certain period of time? Because I know that governments often work on their calendar of funding, and I'm just wondering, does that impact you at all, and how fast you can get the money out the door, recognizing that the need is always going to outstrip what the funding is?
Through you, the chair. Thank you. Great question. Fortunately, for us, House of Friendship was working at having transitional housing up and running anyways. So they had been establishing the program, I think, from even before April. So for us, when, of course, it was very frustrating to not have the funding come online, but when it did come online, we will be able to retroactively go back and use some of that funding for the already everything that's already happened. I mean, literally, we joke around that the beds are made and ready for people and have been for 4 months. So, and the staff are trained and oriented and ready to go. So we will be launching that program by March. And please stay tuned, because there will be information in the community about how you can come in and gain more information about the transitional housing program.
And can you just clarify, it's multi-year funding for Heart Hub, correct?
It is, yes. It's supposed to be 5 years of funding for Heart Hub.
Thank you.
Thanks.
Councillor Craig.
Well, thank you, Mr. Chair. And again, let me just sort of applaud what my colleagues have said about the report and how positive it is in some ways in terms of the decrease we're seeing. A couple of quick questions. Somewhere in the report it mentioned about 40% of the overdose or deaths take place in homes, apartments, that thing. Is that correct?
Through you, Chair. So we do know that the majority of overdose deaths occur in private residences. I'm looking up the exact number. So in terms of toxicity-related calls in 2025, it was 38% that were in private residences, and over half of deaths were in private residences.
Okay. Because from past statistics, it seems to have come down. It used to be around 60%, and now we're down at 40, which is fine. How many, in one of the reports in 2018, it described the number of people taking drugs on a daily basis at approximately a couple of thousand, and that was considered to be conservative. Do we have any new numbers on how many people daily in the community are taking drugs?
So it's difficult to measure the exact number of people who use drugs for a variety of reasons in terms of the stigma and the challenges collecting that data. We look at a few different indicators to help understand the number of people that might be using drugs. One of the numbers that we presented on in the past is the number of needle syringe program clients. So in 2025, it was about 7,600, but that's come down from 2023, for example, where it was 9,200, and 2024 was where it was about 8,600. So that's like one measure that tells us part of the story, but it is really difficult to get that exact number of people using.
Thank you. And if I may, Mr. Chair, just to follow up with a request. I mean, if you look at the statistics here with paramedic service calls, emergency department visits, deaths, everything is down. And there are kind of reasons out there that why that might be happening. But I think we need to have some follow-up to get some more information. Are we missing something in terms of lowering the number of visits, the number of deaths, something that we're missing that has caused this or has resulted in this? And I think the health department could look at this more closely, because you are careful, closely in terms of giving us better information. I think my colleague, Councillor James, talked about data. How are we using it? Is this the reason why it's down? I just think we need a follow-up on this. I'm not looking for a 10-page report. I'm looking for, a page, page and a half, 2 pages about why this is happening, what we should be celebrating, what we should be doing more of to bring these stats down. If I may, Mr. Chair, through you.
Yes, for sure, Councillor Craig. So we touched on it a little earlier in the or rather in response to Councillor James' question, but we can certainly provide more information to Council, such as, for example, through an email. This is this trend that we're noticing in our community is something that is being seen across Ontario,
right,
as well as across Canada, and so the Public Health Agency of Canada, which is an expert body, has looked at this, and they think there may be 3 key reasons that the rates are going down. One is the toxicity of the drug supply seems to be decreasing overall. That is something, as we know, can be very unpredictable, but that makes sense because that's also something that we have some signals that show whenever we have like batches of drugs in the community that have higher levels of toxicity, such as may be detected through drug testing, we can see higher rates of overdose, even though there's been no change in the services offered, for example, right? So the toxicity of the supply, which can be unpredictable because it's an illegal supply, that is one factor that seems to be, because it seems to be decreasing overall, seems to be driving some of that decrease overall in deaths. The other thing that that the Public Health Agency thinks is driving this decrease is an increase in naloxone distribution. As Katie and the others have talked about, this is, and in particular, this is something that the Harm Reduction Working Group has been working on, which since the closure of the CTS, is to enhance harm reduction supports across the community, including number of partners that distribute naloxone so that the access to naloxone can be optimized as much as possible. So that's another reason that we think the rates are going down. And the third reason is, and this is not wonderful news, but the number of people that are at risk for overdose and death seems to be decreasing as well. There have been a number that have already passed away. And so Public Health Agency of Canada thinks that could be the third driving factor, which is that the overall population at risk for overdose is decreasing. So when you take those three factors together, they think these are likely the most plausible things explaining the decrease across the country, which is also happening here in Waterloo Region.
Okay. Thank you, Mr. Chair. I think I got my follow-up report. I appreciate it.
Councillor McCabe, you're the last person of the first round, and really short? Okay, Councillor McCabe.
Okay. Excuse me. Thank you. Just two questions, and thanks for the work you've done and the data and information you're providing. I know it's tough work in this sector, but I'm curious about the ages of people, like if you're able to capture teens, and hopefully there's no one younger than teens, but what the ages of some of the people are. But then my other question is, because I'm nothing if not consistent on this question, is about alternative destination for paramedics. Is the Heart Hub, is that one of the potentials with this? I know the province, I believe that would be for Chief Riches to confirm, but the last time we talked, the province hadn't confirmed or given permission for this alternative level of, or alternative destination. But I'm just curious, is the Heart Hub potentially a place where paramedics, is that the hope and the idea that that's where this could be directed? I'm talking until he gets down.
Through you, Chair, I'll answer the age one first, and then I'll pass it over to the others to answer the alternate destination question. So we do have information on age group, and the majority of overdoses are occurring in the 25 to 44 age range. That's across calls, deaths, and ED visits, but we do have information on each of the age ranges. We can get that to you. It's on our public dashboard. It breaks it down by age.
Okay. I just think, obviously we need to keep an eye on all of this, but, particularly younger people, if we're starting to, or we are losing them, that's, obviously you want to do a lot of upstream work, but, the real cycle then that they're going to be getting into, if there's really a way to try and, prevent that or pull them back from that, I don't know, that obviously is really critical as well.
Yes, and you'll hear about prevention in the next report too.
Okay.
Through you, Mr. Chair, and thank you for the question. And kudos to all of our partners at the Heart Hub and on all the great work they do. Our paramedics see every day the devastating effects of this, and to know that there are supportive options that our patients are getting more access to is really helpful. With respect to alternate destination strategies, we do not have an alternate destination clinic currently in the region. We continue to work with that, primarily with our Heart Hub partners now, and are involved in working groups and committees with them to establish the framework by which we then can apply to the province for that approval. Just to remind Council, one of the challenges is we work under a different part of the Ministry of Health than the rest of our partners do. And in order to get approval to transport to anywhere other than a hospital, we have to go through something called a patient care model standards application process. In order for that application to be approved, there are certain operational conditions that must be met in order for them to say, yes, you can start transporting there. And so that's what we're working with our Heart Hub partners on to do that. I think we can say that for 2026, this is a strategic priority for all of us to try and get this done. You might remember that we presented I think 3 years ago now, I'm looking at Rhonda, yes, 3 years ago now, about another strategy that ultimately didn't pan out. But the reason it didn't pan out was due to a lack of funding, and when we talked to the province, they said, we think the Heart Hub should be where you put your alternate destination focus on, and I think we've all agreed that that's really important to us.
Okay, that's really good information to know. Thank you very much.
One short question.
Okay, I'm going to make this very clear and succinct. So I just, if you could define maybe Dr. Wang or the team here, what is considered a private residence? And then I'm just wondering, again, read the data, if the closure of the CTS site had any impact on, did we lose any data in the way data was collected there? And then if we have decreased incidents of overdoses and deaths as a result, is there an increase as a result? Is there an increase in just the incidence of overdoses? So there's the deaths versus the overdoses. Are we seeing an increase in overdoses and then the decrease in deaths as a result?
Through your chair. First question around the indoor private residences. So that would include apartments, houses, condos, townhouses, and farms. And then in terms of the overdoses that didn't result in a death, we do know that the data that we presented doesn't capture overdoses that were reversed in community where 911 wasn't called. And so we do hear of cases where outreach workers or friends are reversing overdoses where that doesn't happen.
Through the chair, I'll just add that, yes, I think that's the missing piece of data, that there's been a displacement of where overdoses are happening, and not all overdoses lead to death. And so we are seeing community members, neighbors, people on the street responding to overdoses, and that data is not collected. But we know it's not collected, and we are working towards how do we create this system of having community reports, not just reports to the official systems of people who end up making a 911 call or ending up in the emerge.
Perfect, thank you. That's the missing piece I was hoping to capture there. There's a community response element. Thank you, Chair, for letting me ask the question.
Thank you. Okay, I think what we're going to do is move on to the next report related to use substance. I just want to remind committee members, my colleagues, we have a long day. We're just getting started, and I'm having this gentle coaching from the clerk to remind me about the long day. And so keep that in mind, even though this is such an important topic. Thank you.
Good morning, Council. I'm pleased to share a presentation related to substance use prevention supporting mental health among youth in Waterloo Region. This presentation will include a summary of youth substance use and mental health in Waterloo Region, a description of prevention-focused public health strategies that begin early in life that will impact downstream health and wellness, and community strategies that address youth substance use and support mental health. My name is Jonathan Mall. I am the Manager of Substance Use Prevention and Public Health, and I'm joined by a number of organizations and planning tables that work in partnership to support youth in our region. As part of today's presentation, we will share how our work collectively contributes to a community that supports youth. We'll be co-presenting with Pamela Fair, consultant from the lead agency for child and youth mental health, Allison Pearson, Manager of the Children and Youth Planning Table, and Dave Cook, Director of Community Services at the Youth Wellness Hub, Ontario, Cambridge, and Langs. Next slide, please. There is no singular data source for substance use and mental health among youth in Waterloo Region. As such, analysis of multiple sources of data at the federal, provincial, and local level are required. According to the 2023 Ontario Student Drug Use and Health Survey, students in grades 7 to 12 reported using the following substances at least once in 2023: alcohol, non-medical use of prescription opioids, cannabis, and electronic cigarettes. And 87% of electronic cigarettes were nicotine-based, which tells us that nicotine use by youth is still high. Illicit drug use among most students is rare. Next slide, please. Statistics Canada reports that cannabis and alcohol use by youth aged 12 to 25 in Waterloo Region is greater than the provincial average. 41.7% of youth used cannabis in the past 12 months, compared to 25.9% in Ontario. And when asked about alcohol consumption, 37% of youth used alcohol in the last week, compared to 23.8% of youth in Ontario. I should note that due to wide confidence intervals, this data should be interpreted with caution. Ongoing monitoring and improved data analysis will support better understanding of substance use trends for youth in Waterloo Region. Next slide. Multiple sources of data provide a picture of youth mental health in Waterloo Region. The Canadian Health Survey on Children and Youth reported that 13.5% of youth aged 12 to 17 described their mental health as fair or poor in Waterloo Region, compared to 15.4% of youth in Ontario. Data collected in local schools indicate that half of all high school students scored low on the Wellbeing Index. Of youth impact survey respondents, 45% reported their mental health as fair or poor. Next slide, please. Mental health issues and substance use are often linked by the factors that can influence their occurrence. Serious and chronic adverse childhood experience, such as family violence, abuse, neglect, can lead to downstream issues, including problematic substance use and poor mental health. Mitigating and preventing adverse experiences in childhood requires comprehensive strategies and supports for families and communities. Next slide. Supporting families during pregnancy in the early years, as well as building strong and nurturing connections to other adults and community, can be a protective factor against serious adversity. Public health provides programming to help families to prepare for a new baby, to support healthy development during early childhood, and the Healthy Babies, Healthy Children program provides specialized and targeted support where families are facing multiple challenges that can impact family functioning and healthy child development. Also, partnerships with local school boards and youth-serving community organizations provide information to youth and families about substance use with a focus on strategies for not using or reducing use. Next slide. The most effective way to address substance use and to support mental health is to address them before they become a problem. A coordination of community-based and school-based child and youth mental health response creates a cohesive system of care for young people and families. The figure shown here is from the Ministry of Health, and it demonstrates 4 levels of mental health service and supports for children and youth. At level 1, from universal protective factors, to level 2 with mental health promotion, prevention, and early intervention with coordinated referral to specialized and intensive services when needed, and levels 3 and 4 for intensive therapeutic intervention. Next slide. Youth wellness, youth substance use prevention, and supporting mental health work is done by many organizations in our community, including public health. It's not the work of one organization that can address this issue alone, but the sum of our work that is making the greater impact in the community. We are now going to have representatives from key tables and partnerships to describe the work that is happening in the community to address these barriers to accessing services, resources, as well as connecting prevention opportunities for youth in Waterloo Region. To begin, I'm going to invite Alison Pearson from the Children and Youth Planning Table, who will be sharing CYPT's strategic priorities related to children and youth.
Thanks, Jonathan. Next slide, please. Good morning. So at level 1 here in the diagram that Jonathan just shared is where we find the Children and Youth Planning Table. And so the work of the CYPT, of course, is bringing together of adults and young people in our community who are focused on well-being across all ages in our community. Now, when we think about this first level, we have over 100 organizations that are part of it. So that includes these organizations that are here today, as well as many others. And our focus right now is on belonging. We believe and we understand from the research that when good things are happening with belonging, we see other good outcomes for young people. And so when we look at our work taking place across the pillars of research, knowledge mobilization, influence and community coordination, in service of belonging, that is setting young people up in good ways for protective factors when it comes to mental health, when it comes to things like substance abuse prevention. Now, to move us up this diagram into level 2, I'm going to turn it over to Pam Fair. Pam Fair is a consultant with the lead agency of Children and Youth Mental Health and the co-chair of Youth Mental Health and Addictions Prevention Mobilization Team.
Thanks, Allison, and that's like a big mouthful, the Youth Mental Health and Addictions Prevention Mobilization Team. So I'll just call it the PMT, and I wanted to say thanks for having us here today. I'm excited to talk about this really important work that's happening in the community. And the PMT really is the culmination of a lot of work of partners over the last couple of years. And it was formed in 2024 to advance collectively prevention strategies for youth mental health and addictions. And it comes as a collaborative of multi-level partners, including system-level partners from mental health, grassroots organizations, Cambridge Youth Wellness Hub, Dave here, and the school boards, and it's co-chaired together with the Children Youth Mental Health Lead Agency and Public Health. So it was established really to address a gap in coordinated prevention planning in the community. So in the year of 2025, this past year, we've been meeting together actively and have gone through a robust process to really identify the best strategies to support youth in Waterloo region. And I'm excited to share that we finally have landed on 2 priorities that we will move forward with community action over the next 2 to 3 years. And these 2 priorities are, 1, to support the development of integrated youth services through additional youth wellness hubs in the region. And the second is really to address the stigma and awareness issues around mental health, particularly in equity-deserving communities, through culturally anchored and targeted mental health education. And this will include like understanding of risk and protective factors and address awareness and navigation challenges, and we'll be using peer models to do that. Dave Cook will tell you now, this is a lot of what is happening in Tier 2 at the prevention or targeted prevention level. Dave will talk about the great work that's happening on the ground now with the new Cambridge Youth Wellness Hub. So, Dave.
Next slide, please. Thank you, Pam, and good morning, everybody. Across Ontario, there are 32 Youth Wellness Hubs of Ontario networks, or YWHO for short, that provide high-quality integrated youth services to support the well-being of young people aged 12 to 25. On November 3rd, 2025, with Langs as the network lead and support from the Associate Minister of Mental Health and Addictions, Cambridge launched the first YWHO site in Waterloo region, attended by community members, youth, and of course our amazing partners, most here today, including the region of Waterloo. This site includes a dedicated youth wellness team that provides programming and services to meet the growing, complex needs of youth in Cambridge and now North Dumfries. The outcomes and achievements of our integrated youth services model include increasing access to rapid, low-barrier services such as mental health supports and primary care, reducing transitions by providing care in one location, along with coordinated care, and providing tailored, high-quality programs co-developed by youth to meet their needs. There are a number of service pathways that youth can explore while in our space, which include drop-in programs that promote sense of belonging and well-being, community support services such as employment, housing, and education, peer support and care navigation, mental health and substance use services, and lastly, youth can access primary care. As you may be aware, there are significant challenges in hiring nurse practitioners across the province and certainly here in the region. But with support from Public Health and the region of Waterloo, YWHO Cambridge is piloting a new partnership where public health nurses will be on site to provide these services 2 days a week, and we are truly grateful for this opportunity. I'm now going to hand it back over to Pam to speak about the work of Starling as lead agency.
Thanks, Dave. And I would say if you haven't been to Cambridge YWHO, it's really worth a visit. There's great stuff happening. So if you look at the diagram again, you'll see, again, thank you for the next slide, tiers 1 to 4. Starling Community Services is designated as the lead agency for children, youth, mental health in the region. And as such, it's responsible for the planning, access, quality oversight, partnership building, and funding recommendations within this whole system, the entire thing. Starling established the Lead Agency Advisory Council in order to do this work collaboratively. The council includes decision makers from cross-sector, police, school board, paramedics, hospitals, primary care, addiction services, developmental services, child welfare, and public health in order to set priorities and guide the work. In consultation, we develop a multi-year plan It's a service area for the entire Waterloo region and intended to improve the children and youth mental health services. And it's aligned with Ontario's roadmap to wellness, and that's the provincial report governing, the provincial strategy governing how to improve child and youth mental health services across Ontario. So I'll pass it back to Jonathan, and we'll be looking forward to any questions that you might have.
Next slide, please. Our community is recognized for the ways it supports youth through partnership and coordination work that continues through collective and coordinated planning. As part of that, Public Health will continue to provide services that support families and children in our community and work alongside organizations to prevent problematic substance use. Thank you.
Thank you. So don't go far. We have some questions. Councillor Hunick.
Thank you, Chair Erb. Thank you for the presentation from all the individuals and the incredible agencies and work that you represent. Given that we are recognized as a region that values youth and has extensive strategies to support them, I was surprised to learn through the report and through your presentation today that in general, youth in Waterloo region wellness scores are lower than the average, and cannabis use and alcohol use are higher. Could you provide further context for that to me? Because it just doesn't line up.
Thank you for the question. There are various reasons why youth cannabis use and alcohol rates are higher, and that could include the social norms, perception of social norms by certain groups, access to substances, and also the youth's perception of the harms associated with using those substances. And the reasons for having higher rates locally would require more research, but Public Health does collaborate with many partners, including school boards, community organizations, as well as the Youth Wellness Hub and post-secondary campuses to develop strategies to delay the onset or reduce all substances, including alcohol and cannabis.
Thank you. I am interested in the local context and why it would be higher specifically here, but I don't know if that research is being planned or endeavored in at all. But if it could be shared with council when you have something, that would be awesome.
I will.
Thanks.
Dr. Wong?
Yeah, in answer to your question, Councillor Hunick, I just wanted to note that in addition to what Jonathan said, due to the wide confidence intervals for that particular piece of data, it should be interpreted with caution, and that we are planning ongoing monitoring and improved data analysis will support to support a better understanding of substance use trends for youth in Waterloo region.
Councillor Kelly.
Thanks, through you, Chair. This is great. Thanks for coming in. Honestly, I was in the early days of Lang's in the townhouse playing foosball and basketball in the gym across the street. I've talked to the youth council, and they know that if I was not given the opportunities to be in some of these youth programs, I probably wouldn't be sitting here today. Just the way that my upbringing was, I was able to break the chain of the way things were going with these youth organizations. So I applaud you on that. My question is towards, I know that you say you're working with school boards and things like that, but I know there's organizations out there, and I'm going to touch on Air Cadets because that's one of the things that I did as a teenager, and that kept me busy, and worked on leadership and all that interesting stuff. But what is the outreach with the school boards? Is there's any talk about having like a career day when it comes to the youth organizations within the schools themselves so that that information can get to the students? Because yes, I know Lang's has a great opportunity to offer those things, but what are we doing to get that information to the youth of our region?
Yeah, great question. The work that we do with school boards includes education primarily, We have a couple of partnerships, including a Youth Champions Initiative where schools identify champions that can educate other youth about substance use, the harms associated, as well as supports that are available, as well as youth well-being. And we also work on curriculum supports as well. But part of that as well is to ensure that that work that the school boards do is that they also share what supports can be available for youth, and I think that there could be an expansion to include other partnerships as well in that. We could explore that.
Yeah, and I talked to Allison a bit to expanding that and getting out to other youth organizations that might not be a mainstream when it comes to the mental health side, but it definitely does help with the prevention for sure.
Yeah, there is also the work of the prevention mobilization team that is also looking at ensuring that there's opportunities for youth in the community as well.
Okay, thanks.
Councillor Liggett.
Thank you, Mr. Chair. This is so timely because on Friday I spoke on behalf of the big city mayors to the Minister of Finance. Dorothy was in attendance at that. I was asked to speak about mental health and addictions and the lack of funding and the state of emergency that we're in. And I spent all these years as mayor and as councillor advocating for of this. And one of my big concerns is the lack of child psychiatrists and counselors. We have psychiatrists, well, even those, we've got a dearth of, there aren't enough. And so for children, I question how many do we have in the region? Where do those that are in crisis go, like when they're at the youth hub? If somebody brings in one who's in crisis, where do they go? Because we don't even have that at Cambridge Memorial. We, inpatient doesn't exist. There's no place to take them. So the families have them at home. So how many do we have? What are we doing to try to increase that? I fear from the reaction of the minister that there's not going to be money in this new budget that we would like to see. There's going to be very, very little. And do you work with Children's Aid? Because Children's Aid is in crisis in this province. We have some of them a lot of them that are in the red, and some of the province have had takeover with their contracts coming up. I see a lot of them going on strike coming up, and that's the beginning. So when you talk about the school partnership with schools, the partnership should also be with Children's Aid. So what are you doing in your partnership with Children's Aid? They have the highest rate of PTSD and the social workers there versus police, firefighters, and ambulance. They have much higher, but nobody speaks about them. We need those people to stay in those careers. They're dedicated to children, and that's where it starts. So they're the ones who are going to go into the home and notice those things before the rest of the world notices. We can see it happening at the school. So there's 3 questions there, I know, but perhaps Dave could talk about what's happening at the youth hub, what happens when a child is brought in crisis. I don't know. I know what happens at our hospital because I've been in there and spent the time, but I'm worried. I'm so concerned. I can't tell you how concerned I am on this. I dedicated my time as mayor in trying to find solutions. So,
just before I pass it to Dave, I will mention that over the past year, we actually have had a good partnership with the Family and Children's Services, including working with their staff on education around substance use, harms of substance use, but also recognizing signs of substance use. And there's been some training and education that we've done with the staff, as well as attending some of the events that they've held to where families attend and we're able to engage with them. So those have been really successful, and that will continue.
Thanks, Jonathan. Through you, Mayor. Just to touch on a couple pieces. One, the school boards. Yeah, I think all of our organizations have wonderful relationships with the school boards. Speaking specifically to Waihu Cambridge, they are one of our primary referral sources. So the social workers, the child and youth workers, principals, vice principals, when they're recognizing youth who are in need, they are referring them to our services, which is great. We want that. We would love to be in the schools more, doing more outreach. Sometimes that's challenging. And then for youth who are coming in crisis, obviously, we do not provide crisis services in that way. Now, that doesn't mean that youth don't show up at our door in crisis. So what that means is for our very skilled clinicians, they're doing a lot of safety planning. They're making sure that we can keep them safe for a short time. And then we're also utilizing a number of our community partners to provide bridge support, whether that's Camino or Starling, who do offer programs, mobile crisis services. So we are very collaborative in that way until a long-term solution can be found. But you're absolutely right. We love working with Cambridge Memorial Hospital, but we don't have the same resources readily available to them.
Yeah, thanks for that. I have grave concerns for Cambridge, but the whole region and the province as a whole, because we don't have the facilities for children that are in crisis. We don't have the staffing to accommodate that. We don't have the child psychiatrists. It was before this crisis of drugs and everything, we didn't have enough. I think there was one psychiatrist for the entire school board. Yeah. I don't know what there is currently. I should check on that. Maybe you do know the answer to that. But if we don't put the funding, provincial funding, into paying for the education like we used to do for when we had, I forget, we had a lack of, we had unemployment was sky high. The province paid for courses for people to become hairdressers, photographers, PSWs. And I look at that and I think, what a waste of money when we could have given them high-paying jobs as professionals in anticipation that this was going to happen. So there was another question in there, I know, sorry. Sorry, I'm just so passionate and driven about this, sorry.
Hard to tell.
And can I respond to that? Given that the presentation that we're making today is about prevention, one of the things that we do with end of service at Waihu Cambridge is ask a couple of questions to the youth who have accessed our mental health services. And what I can share is that since our launch on November 3rd, one of the questions we ask is, did your appointment today help you avoid going to the emergency department because of the care you received? 30% of respondents said yes. The other question that we asked, could your last emergency department visit have been avoided if you had accessed our services? 20% said yes. So there is space and there is a need for a network like Waihu in Cambridge, in North Dumfries, and the Waterloo region to prevent emergency department visits.
Can I add to that? Go ahead.
Thank you, Chair. I just want to add a couple of comments here. Thank you so much for your questions. They're great questions, and they're very real that I see in families every day. I would like to make a comment. I don't have the exact number of psychiatrists. I can certainly bring that back. But I want to assure you that there are new and building growing structures in which the system that we have in Waterloo region knits together and tries to meet kids where they are. Often the first thought in crisis is hospital and psychiatry. And we actually have significant services and supports that are trying to meet families at whatever stage they're at to address the challenges. And often what we're finding is that it may not be a need immediately for psychiatry, and it may not often be a need right away for hospitalization. In fact, the children youth system as a whole is moving away from and trying to encourage stronger in-home wraparound support rather than out-of-home and hospital support. I'll give you an example of one specific program that's been in operation for about a year now and really meets this particular, addresses this particular challenge. It's called Step Up, Step Down, and it's operated by Starling. It took a good number of years of advocacy to have it funded, but it provides beds for kids who are both either escalating, but not at a spot in which hospitalization is warranted, or youth who are coming out of hospitalization and not yet ready to be back in the family home. And so it's that transition service that meets quite a lot of those challenges where families aren't quite sure what to do and where to go. And Step Up, Step Down has been well utilized over the past year. It will continue in the coming year, and it's being looked at by other areas around the province as one of an innovative approach to start addressing where we have these bottlenecks. The other thing is that psychiatry services has changed a little bit about the way that they work in terms of consultations, and that's through CAPE at the REN. And one of the things that they've done is to change their backlog and address seeing more patients, is that they've changed their long-term follow-up to be stronger in partnership with community, discharging kids from longer-term follow-up into community services care, like many of the partners in the room, including Starling. And that's allowing for additional short-term consultations by family doctors. It's a lot easier to get a psychiatry. It's not easy, but it's easier to get a psychiatry consultation now because their backlog of long-term follow-up is reduced somewhat. It's being taken care of by service agencies within the community, and they're able to see more of those tricky cases. So I don't know if that's specific enough for you. Certainly I can get you the numbers, but I want to offer an assurance that your thought is not lost, and if we don't think at the early stages, we can't just go from early to the end. There is thoughtful action at kind of each of these steps, and with a focus again on helping the children and youth where they are in their home, in their school, what that looks like. So it's upskilling in many cases, many of the agencies and the partners and many of the grassroots organizations around the community to address these kind of challenges in all backgrounds. Thanks.
Okay, I have Councillor Foxton and Councillor McCabe, and then I'm going to try and bring the questions to a close. Councillor Foxton.
Thank you, and through you, Chair. And you brought me back to my youth. I spent all my life working with children. I was the youth coordinator for the YMCA. I worked for the ARMS program with the Board of Education. I worked on Project DARE with the justice system. So, yeah, you brought me back to many of the challenges. And you're doing all the right things, and I want to thank you for that. I have one question. 32 youth networks were stated, ages 12 to 25. What are the 20 to 25-year-old groups? What's for them? Do you get many 20 to 25-year-olds?
For 20 to 25-year-olds?
Do you?
Yes, sorry, yes, we do. We have partnerships with the post-secondary institutions. And so we work with them, and as well as some of the community organizations that we'll work with. It can have a broader range of youth and young adults. So we work in both partnerships with community organizations as well as the post-secondary institutions.
And that's excellent, because that's a phase where they're trying to figure out who they actually are and wondering if they can get a job in this market. Dave, I want to thank you for what you've done in North Dumfries. Are the numbers still fairly good with the youth coming out? It's a great program, and I want to thank you for that. Thank you all very much.
Councillor McCabe.
Thank you. And I'll just add to my question around, connecting in other organizations and that, and just I don't know if you're connecting with area municipalities, because we run a lot of programs, services, clubs, et cetera, that are often aimed at youth. So I think there's some probably really natural partnerships there. And I would just encourage you to either reach out to, like at the City of Waterloo, our neighborhoods team or our recreation staff, and see where there are some overlaps. And then I would just also encourage you to maybe, if you're not already, think of organizations in our community like Kids Ability, because I'm just also thinking of kids with various accessibility challenges and their siblings. They often sometimes are overlooked, but certainly struggle with some, the similar issues that have been outlined today. So I'll just leave that with you.
Thank you.
And if I can be helpful in connecting you, at least at the City of Waterloo, I'm happy to do that.
Absolutely. And municipalities play such an important role with the recreation centers and community centers because they all bolster protective factors for mitigating downstream issues.
Councillor James.
Thank you, through you, Chair. Thank you for this report. It's none of this surprises me. Just being out in the community and speaking with a lot of youth. I do have a question, though, about how this connects back to the parents or caregivers, because I think there is a connection of addressing mental health in youth, but where is that linkage then to the family unit or the caregiving unit? Because, I just think about in certain communities, there's stigma around mental health. So where does that tie into all of this as well? And then I guess I'll just ask both my questions, then I'm done, Chair, around the culturally relevant piece to this, recognizing those who are coming from wherever, the adjustment there, where does that all fit in as well?
Great questions. So just to start off, there's a few different ways, so I might bring some of my co-presenters along to answer some of those questions. But just in our engagement with parents, this is some of the partnerships we've had with school boards is engaging with the parents. And what's most important is the communication and understanding about substances and the risks associated with substances, but also the supports that are available in the community so that if they do need to direct their youth to those support services, they are aware. We do hear often parents will say that they don't know what a vape looks like. They don't even know if their child has it in their bedroom. So some of the education we provide helps to provide that awareness so that they understand what the substances are, the harms associated, and the supports that are available. But there's some additional work that we're doing as well related to equity-deserving groups. So I'll pass it over to Pam.
Yeah, thank you for the good questions, and I see you repeatedly in the community, and so I know you are connected to this work. I wanted to comment first on the parent piece broadly, and then more specifically. So broadly, there is actually a pocket of funding from Ministry of Health for parent support, and that's implemented by Camino in our community, and there are parent learning groups, and there are also additional differently funded parent agencies that support the family piece. So there is some work happening. What I would say is that this is a big part of what the prevention mobilization team is talking about. I mean, youth mental health does not happen in a vacuum. It is not about the youth. It really is about the family. And the more we look at and listen to diverse families, the stronger that voice comes out and the more important that becomes. And so it's a piece of both of the projects that we're putting forward for advancement. One of those is in the youth wellness hubs, and that includes, Dave could speak to what's happening at Cambridge Waihu in terms of parenting information sessions so that the parents can come out and learn what's happening at the Waihu and what their children are dealing with or what they're receiving in terms of support. So that's one really practical example of how it's happening. The second example is really built into the second project that we're prioritizing at the PMT, and that is the culturally anchored, relevant education, mental health education. And it is not aimed at youth, it's aimed at families. And again, this is yet to be funded and yet to be fully developed, but we have significant cultural partners around the table who we're working closely with, who are in fact already doing this work with at times funding from United Way, Community Foundation, Upstream Fund. Our goal is to connect it, to build it more systematized, to weave it into the fabric so that it's there for many families. One of the biggest challenges in that will continue to be raising awareness for parents as to know where, you sometimes only know your neighborhood or your street. And so how do we continue to raise that awareness so that parents feel like they know where and who to go to and even just how to talk with their children? So these are definitely on our radar and are parts of work that's happening and needs to continue to happen. Did I answer your question? Okay.
Is this a short one, Councilor?
Yes, it is. It is. Thank you, Chair. The Youth Wellness Hub at Langs is awesome. For any of you who haven't been there, call Dave. He'll give you a great tour. Dave, my question is, how do we get more youth wellness hubs across our region and across our province?
Thank you, Chair. That is the million-dollar question. Since Waihu Cambridge has been announced, what I can share personally is that given opportunity, I will always promote the work that's being done here in the region and advocate for the need for another Youth Wellness Hub of Ontario site here in the region, whether it's in Kitchener-Waterloo or our surrounding townships. The provincial office of WIHU has changed their model on how they provide funding to new sites. But what I can share is with the prevention mobilization table, we do have and have established a wonderful working relationship with WIHU provincial office. They've come to our meetings, we're building relationships, and we're starting to formalize a structure where we can start doing this work and show them that the region is dedicated and committed to providing this service and can sustain it prior to WIHU being involved. I know that that's one of the things that they're looking for when they're announcing new sites. So they've got a real champion in WIHU Cambridge, and we continue to work alongside the prevention mobilization team in the region of Waterloo to advocate for more sites.
Thank you, Dave from Langs.
I think that's the end of our questions. Thank you very, very much for both presentations. It's quite obvious to see that the success that you're having only happens through collaboration of all the community partners, and that's evident again today. And thanks for continuing to foster that collaboration in our community. Thank you. Agenda item number 8, Council Committee tracking list. Tracking list is for your information. Is there any other business? Councillor Rodriguez.
Yeah, thank you, Chair. And just a question to you. Just hoping staff, could you maybe speak a little bit to some of the programs and funding streams that are available through our housing team to support organizations through the winter, through extreme weather. We've had a pretty cold and tough January, February so far, and just want to understand a bit more about what those look like in the community. Thank you.
Mr. Sweeney?
Yeah, certainly. Thank you for the question, Councillor Rodriguez. Yeah, so our extreme weather and particularly winter weather warming strategy starts in earnest every summer and gets finalized in the fall with community partners ahead of our budget season, so that we can ensure that the plan is in our budget. One of the things that we provide, obviously, and we started this a few years ago, as it relates to daytime warming centers. We've moved away from having those open on weather-dependent days, and so starting in December until the end of March, regional buildings are open 7 days a week, including holidays. So we don't wait for the really bad weather to arrive. And then we have a surge protocol in place, and that is where our funded partners, so this would be warming centers, emergency shelters, street outreach organizations. We have procedures that allow them to respond as they need to in real time without coming to us for additional approvals or supports. And so those are for additional costs with responding to those extreme weather. So this would be supplies, food, staffing, and such. And again, the idea is to plan to put the resources in place through the budget cycle, and then allow our funded partners to respond as the weather rolls in, as we know it always does. Does that answer your question fully?
Very much so. Thanks.
Thank you.
Our next meeting is on March the 10th, and I'm now looking for a motion to adjourn. Moved by Councillor Hunick, seconded by Councillor Harris. Use your e-scribe buttons to indicate your support.
In favor.
Do we have everyone? Okay, that's carried.